My name is Erica Shapley, and I would like to talk to you today about the early intervention of basic first aid and CPR in the event of an emergency. Whether you're at home or you're in a public function or at school or even work. Specifically, CPR, first aid, what you will learn in that training, and how it all will benefit. Imagine for just a moment that you are at a neighborhood barbecue and your neighbor's child falls into the swimming pool. What do? You're standing there helpless and listening to the parents cry, and you just simply don't know what to do. You want to help, but you just can't because you don't know where to start. And the ambulance seems like it's taking forever to get there. But if you had the knowledge and the know-how, you could potentially save this baby's life. You could save time because every second counts. Let's begin, aside from that, of why it's so important to know CPR and first aid. Being able to immediately recognize a situation and know that you need to intervene, knowing how to maintain that situation and manage care, when to step in, all of that could mean the difference between life and death. All of it. The American Heart Association says that over 250,000 people die every year from cardiac arrest, and another 4 million die from injury. Being able to provide protection, reducing the chance of further injury, providing comfort care, and maintaining the best optimal scenario for that patient until the higher level of care EMS and professionals can get there, can give you a much better outcome for your patient. I know you're wondering, what are you going to learn? What are you going to teach me in this training? How can I possibly learn all that I need to know? What they will do is you will learn a basic foundation of skills that covers all types of emergencies. And it's just a basic foundation of things that can address, such as procedures, the order of procedures, like the ABCs, airway before breathing, breathing before circulation, life over limb. If someone has a broken arm, but they're in a burning car, what do you address first? It covers major things like you would know what to do in the event of a burn or a drowning, bleeding, trauma, poisoning, a seizure. There's no way to learn it all. There's no way to learn it all. I've been an EMT for 10 years and I still don't know everything. But what I do know becomes second nature, and no matter how scared you are, your instinct just takes over and your hands will do the work for you, and it makes a difference. Interestingly enough, being able to provide immediate care in an emergency can actually lead to subsequent benefits in healthcare as a whole. Let me explain. The more bystanders that we have that can provide intervention, the more efficient we become as healthcare providers. The National Library of Medicine gives the example that typically on a car accident scene there are more bystanders than there are first responders. But what this does, if these people have the appropriate training and knowledge, they can provide basic care, which frees the hands up of our professional first responders to concentrate on the more critical patients that need it. Another example is being able to recognize a stroke. If you know the signs and symptoms of recognizing a stroke, you will call 911 and they will dispatch the appropriate level of ambulance, which they can turn around and call in a stroke alert to the hospital. Some services even offer a collaboration interview with a neurologist directly into the ambulance through the emergency room before they even reach the patient. To summarize this up, The importance of basic life support is instrumental in saving lives. It's a must. Knowing what to do and when to do it, and when to get help, decreases mortality, improves health care as a whole. You could possibly save someone in your own life. It could be Grandma who fell at Sunday dinner and hurt her hip in the kitchen, and you'll know what to do. Your sister's little boy fell and cut his arm and it won't stop bleeding. You'll know what to do. The combination CPR and first aid produces positive results in timeliness of treatment and the subsequent outcomes. This can't be replaced. This is priceless. I would like to leave you before I go with a quote from Nelson Mandela. Education is the most powerful weapon which you can use to change the world. Knowledge is power. If you just save one life, it will have been worth it. Thank you.